Good morning, everyone. I am Arturo Coego, and I'm delighted to welcome you to today's webinar on opportunities for a housing left shift in Hungary. For those who may not know me, I'm the acting coordinator for the Housing First Hub. Also, I want to give a big shout out to Leonie Pyle, Coordination and Communications Assistant at the Hub, who's working behind the scenes to keep everything running smoothly today. During this webinar, we'll be diving into the homelessness reality, not only in Eastern Europe, but especially in Hungary. We are delighted to have today with us Ella Hancock, Homelessness Programme Manager at World Habitat. She will present us the World Habitat feasibility study on ending homelessness in Central and Eastern Europe. And after her presentation, we will have Eszter Somogyi, researcher at the Metropolitan Research Institute, who will get us through the Hungarian context and potential possibilities of a housing first paradigm shift in Hungary. So I would like to say hi. Good morning, Ella Hancock. How are you today?
Morning, Arturo. I'm good, thank you. How are you?
Good. So back in September, your organization, World Habitat, published an independent feasibility study ending homelessness in Central and Eastern Europe, making the shift to a housing-led system. And you will share with us the key findings of this study. So we are ready when you are, Ella.
Great. Well, yeah, good morning, everybody. And thanks, Arturo and Leonie, for organising this webinar today. I'm really pleased to be here. For anybody that doesn't know me, I'm Ella Hancock. I'm the Programme Manager, the Homelessness team at World Habitat. And today I'm going to talk a little bit about World Habitat, but focus on some of the findings from the research that, as Arturo said, we commissioned into looking at how the Central and Eastern European region can shift to a housing-led system. If you don't know us, we are an international independent charity working across the world to help bring best housing to the people that really need it the most. So we're very solution focused, and that really underpins all the work and that we do, and whether that be our World Habitat Awards programme. So that is organised in partnership every year with UN Habitat, where we recognise really innovative housing models and programmes from across the world, and that's been running for 30 years and over 30 years, and has recognised over 200 projects. We also run a programme, a community-led housing programme, which really focuses on achieving that proof of concept that community-led housing can be developed and really responds to housing challenges. And that programme focuses on three key specific areas, which is informal settlements, former refugee camps, and also the heavily owner-occupied housing markets of Central and Southeastern Europe, which we'll be looking at today. And then thirdly, our last programme is the Homelessness Programme, which is where this work sits, and that has been really focused on delivering the European End Street Homelessness campaign. So we've been running that for 8 years now, and we've been working with 15 cities in that time. The campaign was really inspired by two of our World Habitat Award winners, and we really continue to be inspired by the winners every year and the finalists as well. But the two that really inspired us to set up the campaign were the 100,000 Homes campaign in America, and obviously the work of the Y Foundation in Finland. So what we wanted to do, we set up the campaign to transfer some of the learning from those winners to a European context. And throughout the years, we've supported and funded research across Europe, and we work with our partners, which is generally sort of frontline delivery organisations or umbrella organisations, to help drive change locally. So currently we work with 9 cities across Europe, and over the last couple of years we've really increased our work and our focus in Central and Eastern Europe. So we work with 4 main partners in the region, in Croatia, in Hungary, in Romania and Slovakia, and we also work with a kind of wider network of partners and practitioners as well. Obviously, we believe in housing first and housing-led approaches, and the importance as well of sort of data and evidence-driven advocacy and practice. Evidence from across the world tells us that housing-led approaches work, and we know that in some countries that is easier to implement than in others. That is particularly true, I would say, in Central and Eastern Europe, where there's many sort of reasons why that has been a real challenge, and that's why we wanted to commission this study. So the study, which was completed by Metropolitan Research Institute, and Eszter, one of the co-authors, is here today, which is fabulous, and the Budapest Institute, really intended to fill that evidence gap for the region and to try and understand some of the main challenges and the opportunities that a move to a housing-led system could achieve. We were very keen that this research didn't sort of just sit on a shelf somewhere, but rather was, continued to sort of push and drive change. So alongside a really comprehensive main report and a executive summary, there are also 4 policy briefings, one for each of the 4 countries that we work in, which have got very kind of clear and very tangible recommendations and specific messages for each of those countries. But I would say that there is probably quite a lot that if you're not working in one of those 4 countries, you would still take from those policy briefings, and I would urge people to have a look at them. I'm not going to talk extensively about the challenges in the region. I'm sure Eszter and others could do a much better job of that than I, but just to really summarize some of the key context points that came out of the research. Obviously, we're talking about a region where there is very little social affordable housing, real high percentage of owner-occupied housing. It's a major driver, we know, of homelessness in the region. There's been low public investment in social housing, historical housing privatisation programmes, and very high housing costs, which all contribute to affordability problems and an increase in homelessness that we're seeing. Something else that really came out of the research was the problem of inconsistent definitions and estimates. So it means that we're kind of unable to, we're left with unreliable evidence and data around the number of people experiencing homelessness. And where counts are undertaken, that information is often not shared widely or kind of in a timely manner. We also know that in the region, reactive and short-term emergency and temporary responses dominate. So shelters, outreach centres and day centres, all of which, of course, have a place, but which essentially serve to manage rather than to end homelessness. Also from the research, it's very clear that there was a lack of preventative measures and work across all of the 4 countries. It was very limited. What did exist was often ineffective, and there was very little chance of sort of stopping homelessness before it happened. And another major challenge to organisations and to work in the region is the short-term project funding, which makes it really difficult to scale up or to plan expansion of work and projects. And that's been particularly true in countries like Hungary and in Slovakia, where we've seen really positive outcomes from housing-led programmes, but these have been limited, and short-term funding has meant that it's been a real significant challenge to scale up and continue those approaches. So I thought what would be helpful here, really, rather than go through the recommendations for Hungary or for sort of the more general recommendations from the research, and I would urge people to go and have a look at that, would be to sort of take some of the key messages that came from that research, but also to include some of the work that has come out of some policy roundtables that we've been doing, one in each of the 4 countries. So I wanted to sort of bring together some of the recommendations from the research, some of the key messages, and some of the conversations that we've been having as part of those policy roundtables. So that's hopefully, a helpful thing to do today. So the first one really is housing as a fundamental human right. It underpins obviously all the work that we do, but also the housing-led approach, which promotes the fundamental human right to safe, affordable and decent home. But we know that most government housing policies in the region only help more affluent groups. So one of the recommendations was around governments needing to implement housing-led policies and commit to long-term funding for affordable and social housing for everyone, to tackle that poverty and inequality. Affordability is obviously a huge concern, and something that came out really clearly in the research, and in particular in our Hungarian roundtable discussion, was the need to provide additional or to sort of look at, again, housing benefit schemes to ensure people are actually able to afford the housing that is available. We know from the research and from our work with partners that particular groups, including but not limited to Roma, are additionally kind of discriminated against. And something that came out very clearly was that anti-discrimination legislation needs to be implemented and crucially enforced. And then finally, and very appropriate for Hungary, that governments must consider policies that penalise people experiencing homelessness and further push people into exclusion and limit their ability to access housing and move out of homelessness. Homelessness is a systemic issue. I don't think anybody would argue with that, and solving it really requires an interconnected approach with other institutions. We know that in Central and Eastern Europe, we need to have effective housing policies to address this homelessness, but also to mitigate the risks of increased homelessness due to affordability or eligibility challenges. Policy responses to date haven't adequately compensated for the challenges that have been caused by privatisation of the 90s and 2000s. We know that the fastest way to end homelessness is to stop it from happening in the first place, and preventative work is absolutely key, and policymakers should strengthen prevention mechanisms. Lots of cases of potential homelessness are not being identified, and opportunities to prevent that are being missed. So better connections between social service providers and others, alongside more affordable housing, will obviously help to recognise those and support those at risk of homelessness and avoid people being pushed into experiencing homelessness. And we know that systemic change and implementing a housing-led system really requires a lot of collaboration and cooperation and involvement from many stakeholders, funders, NGOs, local governments, national governments, EU agencies, and the research sort of breaks down the recommendations for each of those stakeholders. So again, please do take a look at that. More affordable and social housing is necessary, and we know, and we've talked about this a little bit already, so I won't go through it too much, but really by prioritising affordable social housing construction, renovating substandard buildings, and leveraging privately owned housing through, for example, social rented agency models, can really provide an opportunity to increase the amount and the access for people to affordable housing in the region. And then lastly on this slide, short-term strategies are expensive and they don't work to end homelessness. So evidence shows that emergency and temporary responses and services are expensive. In contrast, evidence from sort of the small housing-led programmes in the region, and particularly in Hungary and in Slovakia, show that those approaches are much more effective at ending people's homelessness. Long-term funding is obviously crucial to ensure that is possible to implement and to ensure that projects can be sustainable, and that organisations delivering housing-led projects can commit to not only supporting the individuals that are experiencing homelessness, but also can invest in their staff, building capacity and investing in staff training and skills development. Accurate data and reliable evidence is key. We've spoken a little bit about this already, but if we can't accurately calculate the number of people that are homeless, it's really far more difficult to understand how many people need help, but also what the best way is to help them. Governments don't have there's no kind of internationally adopted at the moment way of defining homelessness, nor an agreed way of collecting data. around the numbers of people experiencing homelessness. The 4 countries that we focused on, the researchers focused on in this piece of work, all used a really kind of narrow definition of homelessness, and some official estimates only counted people on the streets, whereas others didn't include those that were in transitional or temporary housing scenarios like emergency shelters. So we really need to have governments adopting a consistent way to measure and identify the problem, and then to use that data in a timely way to create policies based on that evidence. Something that came out really clearly, both in the research, but also particularly, I would say, in the roundtable discussions, is the role that local authorities can have around being a driver of change. You know, with appropriate resourcing and support, they have a really unique opportunity to drive housing-led approaches. And we've seen, you know, that the research highlights some really fantastic examples of where that is happening, you know, by utilising their housing stock effectively and focusing on prevention by reducing evictions, for example. We've also seen, particularly in Hungary, examples where municipalities are using their own sort of substandard housing and renovating that and bringing that back into use. And that is a really, you know, great example of practice, which, you know, should be scaled up and implemented more widely. We also know that engagement with and support for local service delivery partners from municipal level that prioritise housing-led approaches is really key. And that local authorities themselves should consider, you know, piloting and supporting and funding housing-led approaches where possible. And again, out of the roundtable discussion in Hungary, what really came out very clearly was that local politicians can play a really crucial role in encouraging applications, for example, for EU funds, and sharing success stories from other municipalities to really influence state-level initiatives positively. And what we discussed as well was that peer-to-peer learning is crucial, and local examples of best practice must be shared more widely. And then the final 2, I mean, you know, what is really key is that despite all the barriers that exist in each of the countries that we looked at in the region, there is already a lot of experience and drive and expertise in delivering housing-led work. You know, there are some really fantastic examples of this work being led by NGOs on their own, or partnerships between NGOs and municipalities, for example. And what has come out of the research as one of the recommendations is that stakeholders need to build on that, essentially through joint advocacy, through setting up and implementing national networks, and again, from peer-to-peer sharing. And there's a role as well for funders and donors in that, in that they should be supporting and funding long-term advocacy and programmes that focus on effective networking and partnership work, alongside supporting awareness-raising efforts that highlight the effectiveness of projects and the policies as well that help to implement them. And then finally, what came out of the research, but also the roundtables, was that a shift in public and political narrative is really needed. We need compassionate policies that deliver effective housing rights, you know, and also there is a need to depoliticise homelessness, making it everybody's problem, essentially, and increasing buy-in from relevant stakeholders. To help that, challenging negative stereotypes is critical and is really crucial. And engaging community and advocacy groups can help to do that and help amplify the influence and the collective efforts, you know, towards addressing homelessness. There were some interesting discussions as well about the role of the media in this, and whether, you know, how possible it is to influence that and kind of work with different outlets to provide a more balanced view. So that was a very quick whistle-stop tour of some of the key messages and recommendations that came out of the research that was completed by the Metropolitan Research Institute and the Budapest Institute, but also that came out of the roundtables that we've set up since in each of the 4 countries. I mean, this is just an introduction, really. There's a lot of rich information and evidence in those reports and in that main report. So that's it from me. You can read the report with that square. I've put my our Deputy Chief Executive Louise's contact details here, as I'm off on maternity leave next week, but I'm around until then, and then Louise will be around afterwards. That's it.
Well, thanks, Ella, for your remarkable presentation. And now it's time to say hi to Eszter Somogyi. Eszter is not only one of the authors of this World Habitats feasibility study, but also she published with Boróka Fehér an article about the possibilities of a housing first paradigm shift in Hungary. So, Eszter, welcome to the webinar. The floor is yours.
Hello, thank you for inviting me. So I'm going to talk about the possibilities of housing first paradigm shift in Hungary. In our paper with Boróka Fehér, we argued that despite structural barriers enduring to exist in Hungary, lots of experiences and knowledge already has accumulated on the side of the homeless service providers to mainstream housing-led approach in their service delivery system. So before going into the details of the housing-related programs provided by the homelessness service institutions, just first, I would say a few things about the service system in Hungary. So all the social service and homelessness services is regulated by a law, and mainly the local governments are responsible for providing social and homelessness services in Hungary. They can organize themselves or contract it out to NGOs or faith-based organizations. There is a statutory funding for the services that are regulated in the Social Act, but this is not sufficient, and really it means a lack of capacity and the needed services. So what are the main services? Just very quickly, these are soup kitchen, day centers, night shelters, several types of temporary hostels, rehabilitation centers, and also not in the framework of the homelessness services, but in more in a general social service system, there are temporary hostels for families. So basically, the Hungarian service system follows the staircase model, but this is with a dead end because there is no connection with the housing provision system, which means that there are no real possibilities for service providers to help people to get out from homelessness. Regarding the housing sector, we can see that it's very, very limited possibility for affordable housing. Affordable housing means the municipal sector, which is absolutely reducing during this 30 years since the transition of these countries and in Hungary, and also the total stock now is 1.5% of the total stock. So the prevailing form of housing is owner-occupied sector, but the private rental sector has a growing importance, although it is still very under-regulated and does not mean a safe kind of tenure for people who are who have to stay in the private rental sector. The other shortcoming of the social system is the insufficient social and housing benefits, which actually really were reduced in the last 10 years. So people in difficulties experience less and less help from the state and municipalities. So what are the main features of the government policies on homelessness? So we could say that there is no national strategy on ending homelessness, despite there were several recommendations from the field that how such strategy could be combined. There is a positive development that the Budapest municipality just launched its own strategy on homelessness with very promising measures in it. The government policy really have a punitive approach to homelessness, and one of the most extreme measure of this was the ban of street-based sleeping in the constitution. However, it cannot be implemented really in practice, but it really shows the approach of government, like blaming the poor and not providing real possibilities to integrate into the mainstream societies. Despite all this, there has been several programs that helped housing homeless people. These were funded from national and EU funding. And despite this, in this period, this programming period of the EU funds, it seems that there will not be any program for homeless people that helps them to be housed. Okay, just a few words about the small-scale housing programs that were implemented in the last 15-20 years. These programs were mainly implemented by the homeless service providers. So the social the social service system, the general social service system, and the municipalities were not really included in these programs. These programs targeting varying target groups, from institutional users to street-based sleepers, but really had an approach that they rather included people who were more ready for housing. Usually these were short-term programs, so from half a year to 1.5 year long programs. And most of the project used private rental sector to house people, which was a direct consequences of the low availability of municipal housing stores and other forms of affordable housing. And also it showed the reluctance of the municipalities to provide housing for homeless people. All these programs provided rent subsidy. However, these subsidies ended at the end of the project period. So this program was based on the perceptions that with social work support and supporting finding employment, people will be self-sustaining. So, and another main feature of this program was that they try to emphasize the importance of employing homeless people. So after the program, they can sustain their housing. However, we can see that there are a few programs that try to provide long-term housing provisions, and all of these programs use the municipal housing as private renters are not sustainable on the long term because the lack of any housing benefit in Hungary. These programs were provided by NGOs, like for example, sorry, go back. For example, from Street to Homes, NGO and Habitat for Humanity charity services. Habitat for Humanity and the charity services of the Order of Malta. And the other important feature of these programs that they more closely cooperated with some municipalities who provided the housing for the programs. So I would talk about a little bit more detailed about the first deliberately declared Housing First program, which were financed from ESF funds. This was implemented in the last EU programming period, and the call itself really reflected many things along for the Housing First principles. For example, it required the immediate placement of homeless people to housing. There were no obligatory service use required by the call, except for the regular contact with social workers. And practically any needed services could be provided by the service providers. And it required a flexible, individual tailored service provision. And also the implementers could organize training for their staff to learn about housing first practice principles and methodology. So what was not aligned with the housing first principle, that it made possible to target a broader group of homeless people. Although only street homeless people could participate, but it did not require, let's say, the length of homelessness or any complex problems on the side of the clients. It provided rent support only until the end of the program. So this was a kind of structural barrier that no mainstream income or any rent supplement benefits were available for clients after the programs. There were because of this, there was a strong employment focus in the program. And it also did not require the application of Housing First principles from the project implementers. Okay, just a few words about the scope of the program. So altogether, 17 projects were implemented by very different service providers and from all over the country, and they covered around 300 homeless people, out of which roughly one third met Housing First target group criteria. So they were experienced homelessness more than 5 years. And also they experience some mental or substance abuse problems. But all in all, these projects targeted very varying groups, and I would not really go into details with this table. Just I wanted to show that the selection criteria of clients in these programs varied a lot. Actually, we researched 9 projects, evaluated the outcomes of the projects and the service delivery system of the projects. And among these research projects, we find that some of them used this only criteria intention to cooperate. So when they involved homeless people in their programs, so they also included people with mental and addiction problems, but also some of them excluded still people who were using drugs, because, and it can be generally told that people with drug using problems are really something that the current social and health service system cannot deal with. But all the others were hiring more, let's say, easier clients who had less complex problems. So what form of housing provision these programs applied? The majority of people were put in private rentals, and more than 2/3 of them. And the project could experience general affordability problem after the project ended. But really, when they relied on private rentals, they were still very expensive. Even they could provide some rent subsidies for their client. So many projects use this cohabitation model to deal with affordability problem of the private rentals. Only a smaller part of the clients were housing, municipal housing. Although it was very interesting that the call allowed for renovating municipal housing, but as the homelessness provision system are really very isolated from the municipal institutional system, even if the municipalities are responsible for homeless services, very few service providers relied on municipal housing, and also use this possibility to renovate some of the municipal flats. So only one project used this possibility in this program. What other kind of forms of housing were provided? Some of the people were put in worker hostels, and also some of them is halfway housing solutions. It was important that clients did not have to pay for their housing during the project, but they were required to save up money, and especially it was a requirement because after the project there were no other subsidies, financial subsidies for them. So it was very important for them to sustain their housing. So what happened after the support ended? A little bit more than half of the clients could attain their independent housing. And now we could see that those who stayed in municipal rental had higher chance to maintain their housing because of the lower rent level. And also who stayed in private rentals, many of them have to move to a lower end of the private rental sector because they were cheaper flats that they were able to sustain. Okay, 25% of the clients could not sustain their independent housing, but did not go back to homelessness. They moved to their families, relative, or to stayed in worker hostels or flat, but without tenant right. So this kind of halfway housing. And 14% returned to homelessness. And unfortunately, some of them died during the program. Our research also showed that people with more complex problems, with mental health problems or substance abuse problems were less likely to retain their housing after the project ended. So how the organization of support services was implemented in the project. So most of them followed the intensive case management model, and some project elements were used from the ECT model as well. And we could see that those project implementers who work together with psychologists, addictologists, and psychiatrists could involve more their clients in mental health support services. So it was a really important findings, and it was a good experience for the project implementers, that this way they could really stimulate more their clients to rely on health services, mental health services. And another important thing was that these mental health professionals help social workers to provide recovery-oriented support services for clients. Other projects use psychologists as external contracted services, and they were not so successful to include clients in mental health services. Every project, however, experienced structural barriers in health services. So the lack of the capacities of the sector and the lack of knowledge to provide recovery-oriented treatment for marginalized people, for homeless people, it was quite a significant barrier for the project. And it was also clear that the social workers also lack of skills to support recovery of their clients. So what are the main conclusions of all these programs? That were implemented in the last 15, 20 years. We can say that housing-led approach by these really homelessness service providers, institutions, there's many experiences in different fields, how to involve clients with more complex needs, how to provide them services, more complex services, also using some of the health service sectors, but also providing them trainings to develop their social skills. So they really learned and moved toward diversifying their services. Our using housing first methodology meets significant structural barriers. So the very limited affordable housing sector, the very limited social and housing benefit systems, the capacity, lack of capacity of mental health services, and also the social and homeless service sector lack capacity for providing floating support after the specific project funding periods end. And we can also see that there is a lack of skills of social and mental health experts to provide the most marginalized groups. However, service providers accumulated knowledge to provide housing for various groups of homeless people, even people with more complex needs. And they are kind of ready to mainstream housing-led approach to homelessness services by using the principle of separating services, so provide housing and then subsidy services and floating support. And they also are more ready to house homeless people more rapidly. And they also, some of them also started to cooperate more closely with the municipality and their housing services. So they are starting to build up more integrated services in the field of homelessness services, social services, and housing services. But it is clear that structural changes cannot be anticipated in the near future, at least, and that the use of EU funding for housing homeless people would be important very much, but maybe it won't be the case, as I already mentioned. So the more active participation of municipalities to work together, to cooperate with social service providers and homelessness service providers, it will be more important in the future to provide flats to homeless people, and also to provide this social support, the more complex services for them in order to enable them to integrate. Okay, thank you very much. You can see the link to the journal, to the article, and also I just put here the evaluation. It is in Hungarian, so for those who speak in Hungarian. Okay, thank you so much.
Thank you, Eszter, for your great presentation. So we have only 7 minutes left for questions and answers. So we offer to our audience the possibility of making some questions. But if you don't mind, I will start the conversation. I know it will be brief because it's just a few minutes left. But I think it's a very interesting topic. I thank both of you about your presentations, and it looks like Eastern Europe and Hungary in particular, there are big challenges in terms of tackling homelessness. And I wanted to ask you both, since Hungary will be in the presidency of the Council of Europe next year in the second semester, Hungary will be on the spot. What are the chances that Hungary as a country takes this as an opportunity to progress in the fight against homelessness, and, for example, the possibilities about to have a national strategy on homelessness? Do you think it's possible, or what are the chances?
Actually, I don't think that there will be a national strategy. I think the chance is very low, and I don't really see now any positive development on the side of the government to launch any housing programs. We see more positive developments on the side of municipalities, and some of them are really moving toward more inclusive housing policies, and trying to make better use of their housing stock, even to use EU funds and their own funds to renovate the stock and work together with NGOs, faith-based organizations, and housing programs and integration programs of homeless people and other marginalized people. But their efforts are really not supported in any way from the side of the government right now. So the scaling up, it's really a question.
So yes, as Ella said before, local authorities can be drivers of change. And actually, we have one question from the audience remarking that. So Emilia Postolach is asking if there is any other, or there are any other municipalities apart from Budapest who continued their support for homelessness solutions in this financial period.
Yes, there are also other districts in Budapest, so district municipalities who also owns the housing sector, municipal housing sector. They also, and also there are some cities in other parts of Hungary. Let's say Szombathely. It's one city that really provides systematically housing for more than 15 years now. And sometimes they use EU funding, you know, but available for them, but they just develop the system that with projects, they put people in private rentals or with project fundings, and then those who can sustain, and that they move them to municipal housing. And they renovate housing for them, sometimes together with homeless people, and they provide this floating support when they are housed in municipal housing, when these people need it. So it's really like, it's not a very large scale program, but as they are doing this very consequently for many years now, their progress is, their results are quite impressive. So now they already, I don't know, 40, 50 people were housed like this. So it's a long-term housing, and it's independent housing in the mainstream social sector. Unfortunately, the mainstream social sector is very small, but yeah.
I think it's time to wrap it up. I would like to thank both of you, Eszter and Ella, for your time today and to help us understanding a little bit more about the Central and Eastern Europe, and especially Hungary, in terms of the fight against homelessness. And of course, you can find on the chat the links to both the feasibility study from World Habitat and also the article about the paradigm shift of possibilities in Hungary from Eszter Somogyi and Boróka Fehér. And of course, you can find more information on our website, housingfirsteurope.eu, about our next webinars. So thanks a lot, Eszter, Ella, and thanks a lot to our audience. See you next time. Have a good day. Bye-bye.
Bye.
Bye-bye.